in the invitation and focus on a couple of things. You know, one of the big things that has come up in the last, I'll say, 60 to 90 days certainly has been reporting, and so we certainly want to talk about that today. Also want to just talk about some other things that have developed in the last couple of months as well, including some proposed changes to SBCs. I want to talk about transitional reinsurance fee a little bit, and then we'll just close up with some other, you know, kind of housekeeping items that I want to make sure everybody is aware of. And so if you look at one of the first things that we wanted to talk about here today, and just so that everybody's on the same page, and most of you have probably seen this several times before, but just to clarify, when we're talking about, you know, over 50, what we really mean by that. And when we're talking about that for purposes of today, and when we talk about reporting and what needs to be done, it really, there's calculations that need to be configured on your part in order to determine what size threshold you fit in. And so you've seen this slide probably from us before. I actually took this exact slide from other presentations we have done in the past. And just to refresh everyone's memory that when we're talking about 50 full-time and full-time equivalent employees, there's a specific calculation that needs to be done. And this calculation is going to be done, I should say, every year. And for what happened in 2014, it determines where you fit in 2015. And then in 15, you'll do the same calculation for 16, and you'll keep doing this calculation every year to determine where you're at the following year. So it's not a one-time calculation and that's it. It could be, depending on your size, if you knew for sure you're going to fit in a certain size range. But if you're on the cusp of that 50, that magical 50 number, that means something. And if you're on the cusp of that 100, that certainly means something. And we'll go through that as well as we go through this presentation. But in the simplest form, as you can see in the chart here, you would take the number of employees that work 30 hours a week. That's defined as full-time within the ACA rules. Those are considered full-time. So you take all those employees, and you can see in the example here, let's say it's 32. I like to keep the numbers nice and easy for you. Total hours worked by all other employees. So it doesn't matter how many hours they work. You'd add all those up and divide by 120. And that's going to give you a full-time equivalent number. And so as you can see in this chart, 42, 47, 50, and then what would happen is over the year you would say, okay, I averaged above 50, or for this year above 100. That could be important to you as well, and where you fit within the classification. So in this example, as you can see here, you might only have what you would consider 32 full-time employees. However, for purposes of reporting and for purposes of employer share responsibility rules, you need to look at not only your full-time employees, but your full-time equivalents as well. And so I just wanted to refresh everybody's memory on that before we get too far into the presentation, so that you can kind of be thinking about this. And if you haven't done this calculation or you're not quite sure where you're at, by all means, let somebody here at Diversified know we can help you with that. But certainly you'd want to figure that out so you know where you fit within the different parameters. And so let's get into the reporting a little bit. And some of you may have seen we actually produced a couple of Brain Shark videos. And when we send out the links to this webinar recording, we'll also send out the links to the Brain Shark videos as well. Because I'm sorry, I apologize. I'm not going to go into as much detail as I did necessarily in some of those Brain Shark videos, because there's some other topics that I want to cover, and again, we want to try to stick to our time frame here. But as you can see here, and hopefully you can see this chart, you look at it, and depending on if you're fully insured or self-funded, that certainly means something. And on this call today, we probably have a mixture of both fully insured and self-funded plans. And hopefully all of you on the call today, based on what we just went through, have over 50 full-time and full-time equivalents. And so there's one main difference that I want to point out, and then a couple other things on this slide. If you are fully insured and you have more than 50 full-time and full-time equivalent employees, there's actually two forms that are going to be completed. The one form is the 1095B, and that is from the insurer. They're going to complete that form and provide that to the employees. 1095C is going to be your responsibility as the employer, and you will actually provide that to the employees as well as file that with the IRS. If you are self-funded, since you do not have an insurer in place there, and you are the plan sponsor, which generally is the employer, you're going to complete all parts of 1095C as opposed to having a 1095B and C in that scenario. So that's the one big difference, and I'll point a couple other things out as we go along. On this slide, I think it's also important to note that in 2014, although the reporting regulations were delayed, the actual individual mandate was never delayed beyond that. And so, you know, outside of a few exceptions, generally speaking, individuals have to have health insurance coverage or they face the penalties that were laid out there. For 2014 coverage time, essentially right now as far as filing goes, for 2014, all of you probably on this call, as you file your taxes or have them prepared for you, there's going to be a question asking you if you had coverage during 2014. For 2014, it is a self-attestment. There is no additional paperwork that you're going to need to provide with that, except for those individuals that were enrolled in the public marketplace. The public marketplace will actually be providing those individuals a form that they would include with their federal income tax return. And so I think it's important to note that, just so you are aware. You as an employer do not have to provide anything at this point in time. The insurer, if you're fully insured, is not going to be providing anything to the employees at this time. They will be providing information to the IRS, so they have some of that on the back end. But at this point in time, as we go into tax season here, you'd be filling out a form and self-attesting that you had coverage in 2014. For those of you that are large enough that issue over 250 W-2s, you know that you have to provide the value of coverage on your W-2 forms to your employees, and that will be another way that the IRS will try to validate if individuals had coverage or not during 2014. And so let's move along here. Kind of mentioned this already, but just to point out, again, that 50 full-time or full-time equivalent employees is really important here. And the reason being is that if you have over that, and you can see kind of in the bold here, I think this is important for everybody to note, that while the pay or play requirements, do not apply to many employers that have between that 50 and 99 full-time or full-time equivalent employees, the reporting was not delayed at all. And one of the big reasons is that individual requirements, as I just mentioned, were not delayed and have been in place for some time now. And so while the actual pay or play penalties for you, if you fit in that criteria between 50 and 99, are not in effect for this year, you still need to do the reporting. So you still need to be thinking about what that means and what your responsibilities are going to be within that threshold. So that's really kind of the big thing I wanted to point out. There are going to be codes, and I'm not going to go through all the details. I'll show you some slides of the different codes, but there are going to be codes that you would use to identify what size group you are, so that you can make sure that you're not being assessed any penalties that potentially could exist depending on your particular situation. And so as we kind of peel this back a little bit more, I think that there's a couple other things that I want to point out, and I know that some of this is a little bit long in wording, so I'll leave the slide up there for a little bit so you all can read it. But the 1095C, so that really is you as an employer, that's where your responsibility comes in. And what that's going to do is that's going to do a couple of things. It's really going to be used to determine whether the employee, spouse, or children were offered minimum essential coverage and whether that coverage was affordable. Okay, and so that's why if you're fully insured, you're going to have these two different forms that the individuals are going to get. The insurance carrier, as you can kind of see in that bottom note there, they're going to be providing the 1095B, and I'm going to show you the forms in a minute here, so if you haven't seen them, don't worry, I'll bring them up on the slide here, the screen here in a couple minutes. But the insurer, what they're filling out really is going to be the employee and any spouse or dependents that were covered underneath the plan and the months that they were covered underneath that plan. And so there's a potential that depending on when your renewal is, you might have employees that are getting 3 forms, right? You might, let's say you're with United from January to June, and then from July through December you move to an Anthem or a Humana. certainly the carriers, the insurers, are only going to have data for their period of time. And so you could have up to 3 forms that the employees are going to get because you, in addition to those, need to provide the 1095-C. And the reason why is because while the insurer can certainly validate it whether the individual had coverage and all the subsequent spouse and dependents, they do not know what you charge them for premium, and they do not know their eligibility unless you were to enroll them or tell them that they're eligible. And so that's where these 2 forms are going to come together and validate from an employer perspective that you're offering what needs to be offered from a penalty standpoint, and from an employee perspective whether or not they should have received any potential subsidies that they would have received going out to the public marketplace. The one thing that I think is important to note on here as well is if you look at the middle bullet point there, the form needs to be provided to any employee who worked full-time. And even if that person only worked full-time for 1 month, they were never eligible for coverage, they retired, whatever it might be, if they met full-time status, which again, keep in mind, is that 30 hours a week, or if you're looking at 1 month, the magical number there is 130 hours that the different departments have issued out there, then that would mean that they worked full-time. Now again, they might leave the next month, whatever might happen, but the way that, at least as of right now, all the regulations are issued is that you need to provide the form to any employee who worked full-time for the employer at any point in time during the year. One thing to note, I don't know how many of you fit within this criteria, but if you are part of a controlled group, meaning that you might have different companies all aggregated together, you have common ownership. When you do the 1094-C, there's going to be some information you have to list out on there. If you're in that situation, I would just suggest, by all means, contact your team here at Diversified, and we can help you through that. But I just wanted to point a slide in there that essentially there was some question on how this is all going to work, but the way it's written right now is that each EIN would file their own 1095 forms along with the 1094-C transmittal form, but you would mention that you're part of this larger controlled group so they can do the proper assessment on that aspect of it. Before we get into the actual forms, just want to kind of talk about due dates and some privacy here. So the individual's form will be first due February 1st, 2016. If you are talking about the roll-up, as we kind of call it, or the additional reporting that you're going to be provided to the IRS, depending on if you're filing by paper or if you're filing electronically, you can see the due dates there, either the end of February or end of March. There is an interesting thing here, these next 2 bullet points that I think is important to note, because if you do not have some of this information, you're going to be required to attempt to get this information from individuals. And although certainly within the healthcare field and ID cards and everything else, we've gone away from Social Security numbers, because we're dealing with the IRS and taxes here, Social Security numbers are important. And so if you are concerned about transmitting Social Security numbers, you can use a truncated number on the 1095-C that you provide to the employee. However, you cannot do that with the IRS because they need to do this cross-checking on the back end and validate between potential subsidies and if they had coverage and penalties and everything else that goes on. And so you can see there they've specifically lined out that you must make 3 attempts to obtain that Social Security number. And you can see that it goes on there when they first become covered, and then additional attempts the following calendar year. So I would recommend to you that if this is something you currently don't have for everyone for some reason, that you would want to start to go through that process and get that information because you're going to need it for the filing that's going to go on within these 1094-C/1095-C forms that are going to need to be submitted to the IRS. And so with that, I'm just going to pause just for 1 minute just to check on questions before we get into the actual forms. So I'm just going to put everyone on mute just for a second here and just check with questions. All right, so we have a couple of questions, and the one question that I'm actually that asks about the dependents as well, and I'm going to get to that in just a second, and regarding dependent Social Security numbers. And so we'll get to that as we get into the forms. That's a great question, and some of the other questions that are kind of coming in here as we get into the forms, I'm going to address those as well, regarding, again, who needs to provide what and how that works. So some great questions coming in. We're going to go ahead and keep moving forward because I think I'll be able to address those as we go through these next couple of slides. And so let's get into the forms a little bit. Here's the 1095B, and again, this is the form that is going to be provided by the insurer if you are fully insured. If you're self-funded, this form is irrelevant, essentially. But if you're fully insured, this form is going to go out. And this form is going to go out regardless of the size. So if you're on the cusp of that 50 full-time and full-time equivalents, and maybe you're under that 50, or they might go back and forth from year to year, this form still will be issued by the insurer. So anybody that is part of a fully insured plan is going to get this number, or I'm sorry, this form, and that's going to happen regardless of the number of employees you have. And so what's going to happen here is you'll see this form, and the main part of this form is going to be that Part 4, as you can see on here, in the covered individuals. And somebody asked the question about Social Security numbers for dependents. You've probably noticed over the last couple of years, and as we've enrolled in new, let's say we changed from a United to a Humana or vice versa, we've been asking for more information and asking for Social Security numbers for dependents as well. And this has kind of all been leading up to this. And so you'll see that question being asked more if you don't currently have that information. However, you'll notice on there, it's kind of hard to read, but Part C and that within Part 4 is if the Social Security number is not available, they can use the date of birth. But you're going to see, if you have not already seen that, the insurer is asking for dependent Social Security numbers as well because of the reporting that they need to provide. Because not only do they provide this form to the individuals, they also have to provide copies of these forms to the IRS. And so just like you're going to be providing 1095Cs to the IRS, the insurer is going to have to provide 1095Bs to the IRS as well. And so this is kind of this form. This kind of highlights, if you ask me, within this form. There's a number of other forms and things I want to go through, so we're going to kind of keep moving along here. This is the 1094C, which is really the transmittal form. So you will, as an employer, transmit this form if you need to, based on the size requirements that we talked about earlier, along with a copy of all the 1095Cs. We'll go along with that. And you will have to, you can file, let's say you want to do a test run, you can absolutely do that if you want to, come next year. But there's only going to be one that will be your actual official filing when it comes to transmitting this form to the IRS. And so just to kind of keep that in mind, but there's a couple of pages. I just have the front page on here. There's a couple other pages that follow this that would list month by month the number of employees and full-time and some other information. Even checking as of yesterday, these still are in draft form. Once they officially become available, we'll certainly send this out to everyone so that they're aware of it. It was anticipated. There was a lot of talk about it being finalized before the end of 2014. That still has not happened, or at least and all the resources we use have not seen that yet. But so this is just this will be the kind of the transmittal form, and you can see kind of who you are. In addition, as I mentioned earlier, if you're part of a controlled group, you list the other groups that you're a part of on here as well. And then again, the additional forms that would go with this would really be not only the second page that lists the number of employees per month, but also copies of all the 1095Cs as well. And so let's get to the 1095C. Here is a copy of, or at least in the draft form still, of what the 1095C looks like. And what's going to happen here is the big part is going to be, part one I think is pretty straightforward, a name, rank, and serial number as we would call it, and then the employer, so who you are, and some of your basic data. Part two is really where this form really the purpose behind this form. And so that's where we start to get into the offer of coverage. We start to get into the cost of premium. We start to get into safe harbors that you're using as far as premium share and then the affordability aspect of it. Part 3, if you are fully insured, you do not need to do Part 3 and list the covered individuals. If you are on this call and you are self-funded, then you would be doing Part 3 as well and listing out all of that information. So there's a little bit more information you would need to be producing if you are self-insured. If you're fully insured, again, you would do Part 1 and Part 2 on these forms. And so this is really where we talked about earlier. It's going to catch how many months they were offered coverage. Maybe you're using a look back because you have a lot of part-time employees. So you'd have a code for listing that they're part of a look back, or maybe they're in a waiting period, or maybe they're not eligible for some reason. That's where all these codes are going to come in and be produced on this form. While we're on this form, before I get into the codes a little bit, I just want you to kind of look at it. If you notice, if you go to Part 2, the first column is all 12 months. If you are, let's say you're a calendar year plan and you don't change, contributions, it's all laid out there. The individual is covered all 12 months. There was no change in their criteria as far as eligibility, waiting periods, look backs, any of that. You would actually fill out that first column for that individual as all 12 months. And then the rest of the columns you would not need to complete. However, if somebody changed, again, criteria, maybe they became eligible, maybe they started employment, maybe they dropped off, whatever it might be, then you're going to need to actually fill it out for each month for that individual based on their specific situation. So hopefully that kind of gives you a little bit of a picture. As we get forward here, there are actually numbers that correspond to all of my bullet points that I have listed on the screen here. And I did not include those, mainly because I don't foresee a lot of changes going on there, but as not to confuse anybody any more than this is already confusing, even for those of us that see this every day. I left those off in case a code changes from, essentially if you go down this list, you'd go 1A, B, 1A, 1B, 1C, 1D, but I didn't put those on there in case some of those change. But I wanted you to kind of get a feel for what we're talking about with all these different codes. And so I'm not going to go through all of these, certainly, but if you look at it, so the first one, offered minimum value coverage, the employee, the contribution for self-only, less than or equal to 9.5% of the FPL, federal poverty level, right? So that would be a code. Or maybe you offer minimum value coverage to the employee only, or you can see here the dependents, the spouses. This is where they're starting to gather all that information, again, for all the coding to determine not only employer potential penalties, but employee or individual, I really should say, potential penalties as well. There's a couple of slides here. I'm just going to kind of move through these because I want to be sensitive to our time. Other codes, if coverage meets minimum value and the employees share lowest monthly premium for self-only coverage, eligible for each month. Again, not the premium that the coverage was elected for the employee. And we've gone through this a number of times in our presentations as well. Please keep in mind if you have multiple plans that you're offering, or even if you don't have multiple plans that you're offering, all the affordability measurements are off of the self-only coverage when it comes to determining for safe harbor purposes and all the reporting that goes into it. You have employee status code. This is what I mentioned earlier. They were not employed. They were not a full-time. They were on a assessment period. All these different codes, again, that kind of get at should the person have been doing this or should they not have been doing this. So you can see what that looks like. Again, more status codes that go into here as well. This really gets into the safe harbor. This is kind of the third part. So the last couple of slides have kind of been part one within that, the first line, part two, and this is the third part. So again, this gets back to what safe harbor are you using? Are you using W-2, meaning that 9.5% of the employees, box 1, W-2? Keep in mind, for those of you who have heard me say this before, I apologize, but it's box 1 W-2 wages that needs to be done at the end of the year. Be careful if you're just using what their salary is, because that certainly could be adjusted based on participation in a health plan, a 401k, you name it. Anything that could reduce that box 1 W-2 wage could have an impact on that safe harbor, and you would need to do that for each individual at the end of the calendar year to determine that. The federal poverty line or level and the rate of pay are what we call prospective calculations that you can use. And again, we can certainly, if you have questions on this or need to do this, by all means, please reach out to us, and we'd be more than happy to assist you with that. And there's also going to be codes, too. If you're a non-calendar year, there is some transitional relief that exists as long as you're meeting certain criteria. So that's going to be important as well because if you're a March renewal, and that's when you start, offering some of the things you need to offer. Maybe you didn't in January and February, but you still met certain criteria. You don't want to have a penalty assessed for you during those particular months. And so I'm going to pause just briefly again here just to kind of check on some more questions before we change into a couple other topics that I think we'll be able to move to relatively quickly. This is a great question, and I'm glad that somebody asked this because I had my note written down on it and I passed right over it. Union employees. This is a great question and comes up a fair amount. Union employees are still, I shouldn't say still, are technically your employees as the employer. And so the requirements still fall on you as the employer. Now, that certainly means you're going to need to get some data from, depending on the union situation and their plan, you're going to need to get some data from them in order to be able to handle all this reporting. But union employees are your employees as the employer, and then ultimately are your responsibility for purposes of all this reporting that we talked about. So I'm glad that somebody asked that. I meant to mention that, and I apologize I didn't, but I'm glad you asked because that is important to note. Some other questions that came up about software and providing slides I'm going to get to in kind of my closing remarks. But let me just see if there's any other questions here that I want to address at this point in time. And I'll address a couple of those as kind of my closing remarks as well. So that kind of is going to close out our portion on the reporting. I know that's important to everybody, and if we have some time at the end, I'll certainly address some more of these questions. But to try to be sensitive to time here, I want to touch on a couple of other items here as well. Transitional reinsurance fee, I just wanted to point out a couple of things that really came up in the last couple of months that I thought was important to note. If you're fully insured, this really is taken care of within the carrier as they would do the filing on your behalf. But if you're self-funded, I think that I wanted to note a couple of things for you. And I just noticed a typo that the fee is not $63,00. It should be $63 per covered life. But a couple of things. One, you'll notice the fee goes down, and the fee is a 3-year fee. So that was by design. So it's $63 or was $60 from 2014. It drops down to $44 for 2015. It's expected to be approximately $27 in 2016. For those of you that are in this situation, you know that they delayed some of the filing. So it was intended to be November. They delayed it to December 5th last year, but it's going to be November this year and 2016 as well. And there's a couple of ways you can pay. You can pay in one installment, which would have been due or was due January 15th, and will be due January 15th of each subsequent year. Or if you were doing the 2 installment, you could do that, and there's some proration that goes on. With the larger portion, in this case, for this year, it would have been $52.50 due January 15th, and then November 15th, you could pay the other $10.50 that was due on that. But that's kind of just a refresher for everybody on that. What I really wanted to talk about is we noticed a couple of things as time went on, and as this was the first year this really happened, we saw some developments that I wanted to point out to you. And the reason why I bring this up is because you have the ability as an employer to change the calculation method you use from year to year. And so the one thing that we noticed is initially, and when this was talked about, the snapshot count was kind of the method that most employers were looking to use. And really what that means is that every quarter, for the first 3 quarters of the year, for the same period of time, let's say it was the first week in the month within that quarter, you would look at and you would get a count, a snapshot of the employees, or the covered lives, I should say, the covered lives you had, so employees, dependents, retirees. You'd get a snapshot for that, and then you would average that out and multiply that times the particular, in this case it was $63 for last year. However, these are the methods that are allowed: actual, count, snapshot, factor, and Form 5500. What we noticed, and depending on the makeup of the group, I wanted to point this out to you, that you might be better off using a snapshot factor method. And really what that means is that I kind of put a little, just a quick bullet point on this, but you'd multiply the number of participants with other than self-only coverage by 2.35 and add that to the self-only coverage, which certainly would be 1, okay? And the reason why that might make more sense depending on your group is that what we found is as we started to go through this exercise, if you use this method versus the snapshot count method, the fee that you were due, or the fee that was due on your behalf was less. And so, again, depending on the makeup of your group, if you skew lower, let's say your average counts, you have a lot of employees and a lot of employee spouse coverage and not a lot of other dependents, if that would be the case, and you're more around the 2 number, you might be better off using the snapshot count method. But if your average family makeup is over 3 in some regard, you certainly could be better off using the snapshot factor method. And we found this out, and fortunately there were some delays in the reporting requirements on that. And so we ended up kind of last minute working with a lot of our clients and changing some of that. And so I wanted you to be aware of this because you can, if you use one of these methods, you can use a different method this year, and it just might be something you want to look at as time progresses on. A couple other things I want to talk about. Recently, as I think it was December 22nd technically, there was some proposed changes that were done on the summaries of benefits and coverage, or SBCs, as we call them. And just a refresher, the purpose of the SBC is to provide individuals with standard information so they compare medical plans and make decisions about which plan to choose. Okay. There are some proposed changes out there that would be effective for plan years and open enrollment periods beginning September 1st of this year. And what it does is it eliminates and reduces certain things. The departments, different departments, Department of Labor and other departments have categorized some information as not being required by law, and they did some collecting of some data from individuals who did certain polls, and they found that some of the information was less useful for choosing coverage. So they've taken that out. They've reduced it from 4 double-sided pages to 2.5 double-sided pages, so some of this is certainly, I think, good news for us to hear and understand. But there's some interesting other things that have changed on this. So there's an additional cost example for a simple foot fracture treated in an emergency room. And you might ask, why a simple foot fracture? Because they've determined that that is something, that particular scenario is something that a health problem is determined that any individual could experience. While the other 2 examples, in case you're not familiar with it, is having a baby and managing type 2 diabetes, they've determined that that only affects certain individuals. So they're requiring a 3rd example within there, which again is going to be a foot fracture treated in an emergency room, so people get an idea of that. So that's one thing to note. Some other things that are changing on there, in a good way, annual limits for essential health benefits and pre-existing, as we all know, has been removed now, so there's no need to have that, which is good. However, information regarding minimum essential coverage and minimum value has been revised and must be included in that. Again, if you're fully insured, the carrier is going to be producing these for you on your behalf. I just want you to know it. If you're self-funded, you're responsible for these as a plan sponsor, so good things to be aware of. Premium information may be included but is not required, which is, I think, a great thing. You must include an issuer website where they can access the certificates of coverage. So that's again, if fully insured, not a big deal. If you're self-funded, certainly something we want to address and talk about. A couple other things on here is you can provide the SBCs in electronic format to plan participants, certainly in connection with their online enrollment or online renewal. Again, it may be provided to electronically to all participants. There's no problem with that. However, you have to allow for the option to receive it via paper upon request. Okay. So if they request it online, can do that. But if they request it via paper, you have to be able to do that for them as well. And so just to kind of, again, a couple of things to note, some changes that we're seeing. I think as time goes on, we'll see other changes along this line. And the SBCs has certainly been one that we've been kind of waiting on some additional information for. And again, this just recently came out in the last couple of weeks, so I thought I'd make everyone aware. If you want more information on it, here's the websites. And the last bullet point on here that I think is important, and there was some question on this, I think, but this has been now validated, is SBCs are required for health reimbursement arrangements. And so if you are in that scenario, let's say you are fully insured, but you have an HRA as well, if you have not been, you are going to have to provide an SBC specifically for the health reimbursement arrangement, because that is considered a health plan. And so that's probably, for a lot of you on the call right now, might be the biggest change potentially if you have not been doing that. But again, these are proposed, it could change, but at this point in time that you're going to have to do that for those health reimbursement arrangements. And if you have not been, you're going to have to start doing those, again, starting with the open enrollment or renewal on after September 1st of 2015. Last formal slide, and I apologize, I realize that I talked too long and we're running a little bit over. But just annual limits, I wanted to point out just a couple of things and I have some closing remarks. For 2014, you probably heard a lot from us in that the out-of-pocket maximums allowed on health plans really matched the HSA guidelines. For 2015, that actually has changed. And so that's why I want to just spend a minute on this. The out-of-pocket maximums allowed for a high-deductible health plan or an HSA plan, as you can see on the screen, are $64.50 single or twice that for family. However, the out-of-pocket maximums allowed for non-high-deductible health plans, so your traditional plans, and again, non-grandfather plans, which most plans are nowadays. It's been difficult for some to keep that status. The out-of-pocket maximum is different. It's $6,600 for a single and twice that for family. And so as we go through the renewal process, some of you probably already seen this. Others of you that renew or haven't renewed yet, you're going to see this. This is a change, and we anticipate that gap potentially widening as time goes on. You can see minimum deductibles and where those are at, maximum deductible. The one thing here I think everybody's aware of, but still we get this question a fair amount, there was wording in the law that was maximum deductibles in certain size requirements, but that has been repealed, so that's not out there. Maximum contribution for HSAs, for those of you that fit that criteria, you can see what those numbers are. For FSAs, for all of you, hopefully you are aware, or again, if you haven't renewed yet or not aware, there was some inflation there on numbers on that, so that was $2,500 last year. That bumped up a little bit to $2,550, so individuals can put a little bit more in there. Catch-up hasn't changed for those of you that's appropriate to, and again, they allowed that carryover of the $500, some time ago now. But if that's something you're interested in doing, make sure you talk to somebody here at Diversified so we make sure that you get that set up properly. So that kind of concludes the formal presentation here. We will, as I mentioned, we'll be sending out videos. This is being recorded. We'll send out videos early next week. We'll also include links for Brain Shark videos we did that details the reporting some more, so you can have that. If you would like a copy of the PowerPoint slides, please contact one of your team members or Christine Mickey from our organization, and we can certainly help get you that information as well. And the last thing I wanted to do before I try to answer a couple other questions, we'll take a couple minutes on that, is you are going to see a lot of activity this year based on the political environment that we have in Washington, D.C. However, I don't know that it's going to actually come to fruition or go anywhere. For example, you might have read a lot in the last couple of weeks, through the House, they passed a bill that would change the mandate from 30 hours a week for full-time for employers to 40 hours a week for full-time for having to offer coverage. I think that most employers, depending on your environment and what your philosophies are, would certainly welcome that if you have not been offering coverage. However, that even if that gets to the Senate, which it has a good chance of doing that, I don't see that getting past the president's desk. And so you're going to see a lot, some of the political things that are going on there. You've probably been reading more lately. The total repeal is that conversation is dwindling. It's more making adjustments like I just talked about on what's required as far as who's an eligible employee. And so I think you're going to see a lot of activity on there. I just don't know how much of it actually is going to be impactful to you. So I think it's worthwhile. We'll do our best to keep up to speed with some of these changes and potential changes. However, I think that it's important to note that we need to act on what we know. The information presented today is information that we know, and we would rather be in a position to make sure you're prepared for things than, hey, this might get changed or this might get repealed or this might get adjusted, because I don't think a lot of those things are going to be able to go through all the different channels they need to go through to be implemented into law, at least based on the political environment that we have currently in Washington, D.C. And so with that, again, that concludes kind of the formal presentation of my remarks. I'm going to answer a couple questions. If you want to stay on the line, I'll take a couple minutes here. If you have to drop off, thank you again so much for your time and attention. I appreciate it, and we'll have some follow-up items for you. If you want to stay on, and I'll try to get through some of these questions. If not, we will also prepare kind of a Q&A document as well, as we have in the past, and try to answer as many of these questions as we can at that point in time. And so one question is software available. Yes, we have access to software, independent software that can help with reporting. Some companies are using payroll software that's potentially could be a fit. Some clients are using benefit administration systems or HRIS systems, which could be a potential fit. And there are then standalone products as well. And we have access to all of those and are aware of the market, are aware of the different capabilities within the different payroll companies and HRIS systems and benefit administration systems. And so if that is something that you're looking for or need, again, please reach out to your team, and we can certainly help you with that. Instead of saying, yes, this is it and this is the cost, we really would rather have a conversation with you and make sure that we position you correctly based on the needs that you have based on your workforce in place. But absolutely, if that's something you're interested in, let us know, and we would be more than happy to help you with some of that. And a number of people I know have asked about, again, copies of the presentation. Yes, we'll be getting that out, so I want to make sure we address that. Certainly a number of questions on the forms. And so back to the form and self-funded, yes, the 1095, and this is actually kind of a multi-level question, I think, but the 1095-C would need to be provided for each employee if you're fully insured or self-funded. That's important to note. If you are self-funded, though, however, you have some additional responsibility because there is no insurer providing the 1095-B, which would show the months that the individuals had coverage. So you'll need to complete that part as well. But you are going to have to, as an employer, if you're over that 50 full-time and full-time equivalents, provide a 1095-C to every employee, and a 1095-C along with the 1094-C transmittal form to the IRS for all those employees that you had. And again, even if they did not meet criteria for eligibility or on your plan, if they were a full-time employee at any point in time during the year, you will have to provide a 1095-C to those individuals as well. And so the good question on reporting requirements, and this is actually has come up a fair amount. As of now, and it still is out there, it could change at some point in time, but reporting of the cost of health care is only required for those of you that are employers that issue, not employ, but issue more than 250 W-2s. And so if you issue more than 250 W-2s, you have to provide the value of coverage to the individuals on their W-2. If you are less than that, you do not, there's still no, the requirement to provide that data has still been postponed or delayed. And so at some point in time that might change based on all the things we just went through today in the reporting. But at this point in time, if you produce less than 250 W-2s as an employer, you are not required to offer, or I'm sorry, I shouldn't say offer, you're not required to list the cost of coverage on their W-2 form for them. Like I said, we ran over a little bit. I apologize for that. I'm going to end the presentation at this point in time. Again, you look for the presentation coming from us early next week. If you do have any questions in the meantime, by all means, feel free to reach out